Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'm going to provide a rebuttal to the widely circulating video of Dr. Dan Stock and the claims that he makes on his video. As with most controversial and incorrect statements about the COVID pandemic, some of the statements that Dr. Stock makes are half-truths. Let me help you discern fact from fiction. Let's examine 5 statements that he made during his speech, and I'll provide context and scientific data to help you make an informed decision about the truthfulness of his statements. Let's start with statement number 1. He says, "Things you should all know about the coronavirus and all other respiratory viruses is that they are spread by aerosol particles, which are small enough to go through every mask," end quote. Dr. Stock made this statement in opposition to using masks. And it is true that respiratory viruses are spread by aerosol particles, but he forgot to mention that there are also liquid droplets in addition to aerosols, and both of them come in a range of sizes depending on what activity you're doing as you emit these particles. For example, quiet breathing will not emit the same quantity or size of particles as sneezing would. It's irresponsible to say that masks don't work simply because all of them do not filter out the smallest aerosol particles. Numerous studies have shown the effectiveness of masks, from the N95 mask to disposable medical masks or reusable multi-layer cotton masks. I chose one study from a well-known trusted medical journal called the Lancet that was published in June 2020 that confirms that masks are helpful. They did a systemic review and a meta-analysis of 172 observational studies with data from SARS, MERS, and COVID-19 infections. Let's look at this chart from their study. Now, don't get overwhelmed with all the numbers. Just look at this bottom section to see that overall, every one of these studies favored mask wearing to prevent illness, and they had data to back this claim. I'm honestly surprised that we're still having this debate over whether masks work or not. They do. The data supports them. They reduce the amount of particles an infected person emits and reduces the amount of exposure to large respiratory droplets. Just because they don't protect us 100% of the time does not mean they should not be used. Okay, statement number 2, quote, "No one can make this virus go away. Smallpox had no animal reservoirs. The only thing it learned to infect was humans. That's why we were able to make that virus go away," end quote. This is one statement that I think is true, and the messaging from the CDC is confusing because I did hear Dr. Fauci on NBC Nightly News on Thursday, August 12th, alluding to the eradication of SARS-CoV-2 like the eradication of smallpox, measles, and polio through the vaccine. Let's listen to his statement.
Are either history or precedent on our side in terms of how all this ends, how this virus ends?
There is history and precedent on our side. If you look back at the history of devastating diseases and epidemics, smallpox, polio, measles, what was the solution to that? It was universal vaccination. If we had an attitude of people not wanting to get vaccinated, we may not have eliminated polio from our society.
But honestly, I just don't think eradication is going to happen. I think that SARS-CoV-2 is going to become something like the annual influenza season, where there are mutations that happen in the virus over a period of time, and the vaccine will be used to reduce COVID-19 illness and severity. I can see having an annual influenza and COVID-19 combination vaccine. And when I searched a bit more, Dr. Fauci has stated in the past that he doesn't think SARS-CoV-2 will be eradicated either. I just think he misspoke in that interview. And look, we're continually learning about SARS-CoV-2. It's only been around for a short time. But once again, this is not a reason to not get vaccinated. And it's not a reason to completely dismiss the CDC and its recommendations. I just don't see how you can make this leap. Statement number 3, quote, "Why is a vaccine that's supposedly so effective having a breakout in the middle of the summer?" Stock suggested that COVID-19 vaccines are ineffective because some populations are experiencing COVID-19 outbreaks. He specifically cited a July 2021 study published by the CDC reporting a COVID-19 outbreak in Provincetown, Massachusetts, in which 75% of the over 900 COVID-19 cases were detected among fully vaccinated individuals. I've addressed this concern in a prior video that I will link below, but I just want to remind everyone that with over 900 cases, there have been only 7 hospitalizations and no deaths. That, in and of itself, shows the value and effectiveness of the vaccines. Is the vaccine perfect? No, and it never will be, but I know that it prevented deaths in this outbreak. Statement number 4 is when he mentions antibody-mediated viral enhancement and says the vaccines have worked wrong in every coronavirus study done in animals on coronaviruses after the SARS outbreak. Let's dig into that a little bit more. Antibody-mediated viral enhancement occurs when antibodies don't block a virus from infecting cells, but instead improve its ability to infect them. This then increases the risk of more severe disease when the person gets exposed again to the virus. It's a phenomenon that can affect any individual with pre-existing antibodies, regardless if the antibodies arose as a result of vaccination or previous infection. And if we look at the data, we're just not seeing this. If this were occurring after the vaccine, we would expect those that are fully vaccinated to have more severe COVID infections. But we know from hospital data that over 95% of the hospitalizations and deaths are in unvaccinated people. Dr. Stock's statement absolutely contradicts the data that we're seeing. And lastly, statement number 5, he says, quote, "I can tell you, having treated over 15 COVID-19 patients, that between active loading with vitamin D, ivermectin, and zinc, that there's not a single person who's come anywhere near the hospital." This statement is probably one of the most difficult for me. For this doctor to say that he's an expert on how to treat COVID-19 because he's treated 15 COVID patients is absolutely ridiculous and irresponsible. With only 15 patients, the likelihood of any of them going to the hospital is low anyway, simply based on the number of people. He could say that he treated every one of them with orange juice, and that's what prevented the hospitalization, but it would not be a causative effect. But as with his other statements, there are some nuggets of truth in this statement. Vitamin D has been shown to reduce the risk of getting a respiratory tract infection by almost 50%. And having a low vitamin D level can increase your risk of community-acquired pneumonia by 64%. And there have been several studies that have shown a possible benefit to having a sufficient level of vitamin D and reducing the risk of having a severe COVID-19 infection. I spoke on the benefits of vitamin D in a prior video, and I'll put the link in the description below. I've also posted several videos on studies with ivermectin. Many of them have been removed by YouTube, but my latest update is on my channel, and I'll put a link in the description as well. But we're simply waiting for more data. I know I'm specifically waiting on data from the principal trial, although I'm disappointed that the COVID-positive patients will only be treated with ivermectin for 3 days. And there's even weaker data on the use of zinc, both for the treatment or prevention of COVID-19. At the end of the day, we don't have any evidence that any medication or vitamin or behavior works as well as the vaccines do to prevent severe illness and death from SARS-CoV-2 and COVID-19. You get to decide who to trust and what to believe. But I believe that Dr. Stock is simply contributing to the spread of misinformation and mistrust of the medical community, and that hurts us all. Thanks for joining me.